Welcome everybody to the Skelata webinar about the revolution in back pain treatment. At the beginning, we just want to make sure that you are realizing that we are recording this. We cannot see you, we cannot hear you. If you can see yourself or hear yourself, and we couldn't change that because of technical incompetence, and just switch off your screen, but we cannot see you at this precise moment. Okay, let's start. My name is Michael, and I am an osteopath and a physiotherapist, and I am one of the founders of Skelata. And I've got my own practice in Munich, Germany, and I'm in that health business for almost 18 years now, I think. Unbelievable. And my main reason to do that is to get people rid of pain, just to help them to get back to normal life. That's what I do.
I'm Nina Olson. I'm a certified neurocoach. And my business is to help people to have fun in their life, to get their relationships well again, to be happy in their business life. And that used to be my main business. But nowadays, I am just focusing on people with pain to help them to get rid of it.
Yeah. And in this special webinar, it's all about back pain. So what is this all about? Skelata, the revolution of back pain, is a unique program we put together for you guys. And it's called the 7 Bridges. And the fun part of this is you have to know the interplay of your pain, your brain, and your body as a whole. So we combine my job and Nina's job, and that's my expertise of osteopathy and her expertise of neuroscientific findings. And that together we put in the 7 Bridges. And before it's getting too theoretical, I want you to grab a spoon, or if you don't have a spoon, a wooden spoon, take a pen. I'm gonna have a wooden spoon. We'll give you a minute or so to go get one.
So you can see.
Okay, I think everybody should be ready. So take your wooden spoon or a pen. Shouldn't be too sharp, no sharp edges, because this technique may hurt. Before I tell you what this technique is all about, why you should do that, I'm going to show you how to do it, and I invite you to join. Okay, what you do, sit down and take your pen or your wooden spoon. You guess I'm sitting now. Can you see that? And then you take both of your hands and put that spoon in the middle of your thigh. Right. And then give it a go. Give it a go. And press it down and pull. And that should hurt, at least a little bit. For some people, it's a little bit more sensitive, for some people not. And I want you to do that in 3 lines. So have a look at that. See that? From the front. So you start in the middle. You're pulling, and oh, it's getting deep. Then take the outside, like that, and really push it. Like that. It's painful. If you're like keen to do that, do it without pants or without any like stuff in between your skin and the wooden spoon. And if it's too harsh, take a little bit of oil or something like that. But just do it. And then you go on the inside of your thigh and do the same thing. Really hard. And you do that 3 to 5 times. And take your time, because you have to get used to that. And do that on both sides. So I'll take the other one. And take your time, you're not in a rush. Other side. Enjoy. You can hear my grunting. Give it a go. 3 times at least for one line. It's like rowing a boat. Outside, that's actually the toughest part. And don't be afraid tomorrow or the day after. There may be some blue lines on your skin, but that's going to be better the more often you do it. Okay, so what you did right now, I'm going to explain it to you a little bit more specific. You released your thighs, and your thighs are connected to your pelvis. Yeah? So what have your thighs to do with your back pain? And why is it important to release your pelvis to get rid of it? Well, I want you to think of your pelvis as a bowl. And this is a toy of my son. To think about your spine like this. Okay? So this side is the front, and this side is your back. This is your vertebra. And at the front side, there should be your belly muscles, you call it. What you do, almost every one of us, is to sit too much. So your thighs are connected to the front side of the bowl of your pelvis. If we sit, the thighs don't have to do anything, and they are shortened. And if we don't use muscles often enough, our brain thinks, well, if you don't use me, if you don't use the muscles, why should I keep them flexible, powerful, and why should they do the job if there is no job to do? So what your thighs are going to do, they're going to shorten or stiffen or get tight. And that will do something like this. Thank you. This will do something like this. This is the extreme position. No, you stay like that because our vertebra is not following. So your thighs are pulling down, and your vertebra has to somehow compensate because we cannot walk around like that all the time. We are doing like that. And that's going to be a problem in your lower back. And if you don't feel the pain in the lower back, it may go up anywhere in the vertebra. So if you do the wooden spoon technique or the pencil technique, and you are like loosening the fascia and the muscles, you enable your pelvis to do this again, like freer than before. That means your vertebra is getting a release. It can move better than before. And that's a reason why, for example, all of my patients, if they walk into my practice, they have to lay on their back. And if they walk in and I say, yeah, get rid of your clothes and lay on your back. Hold on, is that in focus? Oh, hi. Lay on your back. And most of the time, the people just want to lay on their belly and show me their back because the back is hurting. But if you know the interplay, then you can understand why I let the people lay on their backs, because the things are going on the front side. Thighs, inner organs, muscles underneath the organs. We're going to get to that. So this is technique number 1, to get instant pain relief. If you want to get up, stand up, move a little bit around, and you will feel a difference for sure. Okay, I have to put that again. There we go. Okay. Yeah, one way to get back social again, or to get your back social again.
And because the human brain, especially still human brains, as I said before, the brain needs distraction from time to time. And that's what we give our brain now. So close your eyes, please, and take a deep breath in and out, and yawn.
Oh, punch me.
You could do this with your yawning. Stretch your arms and your legs, if you like. This is called pandiculation.
I'd love to see that. We cannot see you, as I said,
No.
but I'd love to see everyone yawning. Okay, what's it all about?
Pandiculation. Pandiculation is yawning and stretching at the same time in slow motion, if you can. So the stretching in slow motion. Why? Because your brain can't focus for more than, let's say, 25 minutes, 30 minutes on one topic. Even if you think you can, you can't. So that's why you have to distract your brain consciously, because you don't want your brain to do that unconsciously. Because, for example, you focus on something that is really important for you, a work you want to do, an Excel sheet or whatever you want to work on. And if you notice yourself, if you just observe yourself, you will notice that you're somehow, after a couple of minutes, sort of drift away with your thoughts. This is what your brain does, because it has to have somehow a release of these concentration.
Distraction.
So you don't want your brain to do that by its own. That's why you do it consciously. And on top of it, your brain gets sort of relaxed. Everything relaxes, and with your brain relaxing, your whole body relaxes.
And then we come to the pain part.
Exactly, because pain is stress. And stress has the very unpleasant, I don't know the English word, I'm sorry. If you are in stress, you have even more perception of pain.
That may be a habit.
Yeah.
It's a bad habit of the brain.
It's a bad habit of the brain. Yeah. So that is why it is really, really helpful to yawn. If you are in stress, if you notice you are in stress, yawn and stretch. And if you feel pain, yawning and stretching helps. So back pain can put you in desperation, as you know. It happened to me in Greece.
That picture is in Greece.
Yeah.
Because in Greece, actually, the birth of Skelata, the epiphany happened. And yeah.
We had a bottle of champagne then. After I became pain-free in the end. So the journey was like this. We had planned a family journey, a family holiday in Greece. And I was really, really looking forward to that, to playing with my grandchildren in the sand and trying to get them to swim and having nice dinners in the evening. And I just thought it would be lovely. And a couple of days before the flight.
Couple of days, that was a little bit longer.
Okay, I was in pain for a long, long time, for let's say 2 years, but I sort of kept it bearable with injections twice a week inside my vertebrae sometimes, and a lot of physiotherapy that made things worse, unfortunately. And and a lot of painkillers, So a couple of days before we were to fly to Greece, I noticed that my pain increased. So I went to the doctor again, and he gave me injections in my vertebrae again, and they did not help at all. So I thought, okay, I'll pack as much painkillers as I can get hold of, and I'll be definitely on holiday with my family, and I'll be enjoying that. So that was...
Of course, if you ask yourself why I didn't notice, a mother tries to keep her pain away from their kids, obviously.
Yeah.
And so I didn't realize how bad it was.
No, I didn't want to I didn't want to tell him, because I thought he has to enjoy his holiday.
Yeah, and then on that holiday, we lived in 2 different apartments. My family, my wife and my 2 kids in one apartment, and mom in another one. And we had a little ritual. Every morning, I took the boys and we went in front of mama's apartment.
On the
balcony, and she's called Nana by the kids. So they're standing underneath the balcony like, Nana, Nana, where are you? And she didn't show up.
And normally I show up and say, good morning, I'll be with you in a minute. And then they go and I come.
And she didn't. So we thought maybe she's still asleep. So we went to the beach. A few hours later, no Nana. Kids were asking, where's Nana? I was like, I don't know where Nana is. In the end, she didn't show up. So I went from the beach to the apartment. And then you were standing at that point, I guess.
Yes, but it took me hours to get out of bed, because the pain was unbearable. I can't tell you how, I can't tell you what has happened. I mean, it was really bad, and it became worse and worse for 4 days. But this night, I tried to get up to get myself more painkillers, but I couldn't. I just couldn't get out of bed.
I walked into that apartment and she said, I need an ambulance and I need a surgery, and I know exactly my back pain is, I know exactly where it comes from. My back is broken. I need a, how do you say that, a fixation of the vertebra.
Yeah.
And then
so I thought I knew that I need my vertebrae, 4 vertebrae, to be stiffened with metal and screws. That is what my doctor said to me. If I won't become pain-free, this will be the only solution.
So then I freaked out, kind of, and said, I'm going to give you a treatment now, and I'm going to treat you like any foreigner walking into my practice. So I said, I'm going to try to throw that mother-son thing overboard. And then I gave you a treatment.
Yeah, but it took me about 10 minutes to come from this position down to this treatment table.
Yeah, and I, as I told you, laid on your back. So I laid her on her back and I gave her a treatment. And then
that took about 6 minutes.
Yeah, and I told her, it is not what you think it is.
And that was the epiphany, because Michael said to me, Mom, your back pain, listen carefully, your back pain has nothing to do with your spine. Wow.
Yeah. And of course, that only makes sense if after that treatment, you feel like, oh, that feels better.
Yeah.
So I didn't touch her spine, and you don't have to touch your spine, because almost always the problem is not your vertebra. It's not your spine. It's the surrounding. Remember, the bowl, the pelvis, everything's stiffened, shortened, and you have to relax that.
And this is what he did. This treatment was nothing else than loosening these fascia that, like Michael showed you. That was what he did. And the result was that I could go up by myself.
To the beach. Okay, and that's why we thought, or that's when I told Mama, we have, what? Yeah, that was the one.
Yeah.
Why don't you use your knowledge about the human brain to get in control of your pain? And we combine that with osteopathy. And we're going to tell everyone how to combine osteopathy and neuroscience to get rid of pain. Because pain is happening in the brain.
Yeah, and I didn't think of that because of my own pain. It is sometimes
Yeah, you thought you were right.
I thought I know exactly what is wrong with me, but that was wrong. So my beliefs were wrong. So my own beliefs were false. So I then knew, because Michael said it has nothing to do with your spine, nothing to do with your vertebrae. Use your brain to get rid of the pain, and I do the rest with your body. So if you know the interplay of brain, body, and pain, you are in charge.
You always got an idea.
You have the power. You know exactly what to do, always. As soon as you are in pain, you know exactly what to do. So 3 days later, I didn't use any painkillers anymore. Of course, I still had pain. It was not just a miracle and disappeared overnight. I had pain, but I didn't need painkillers anymore. So after 7 days, I could join my family at the beach, and I could go swimming again, and I could have dinner again like I planned before. And 3 weeks later, I was completely pain-free. So read this.
Read this. I'm gonna read it to you. This is what this program, The 7 Bridges, is all about. That you understand that you are able to treat your body with your own hands. Somebody has to teach you. We're going to teach you how to do that. Your beliefs determine your perception of pain.
Yeah.
Everybody knows that situation. If you're in a situation and something hurts and think like, it's not that bad and I can handle this, all of a sudden it's not that painful anymore. And this is not hocus pocus, this is science. You can prove that, and you all know that. Your mind has power over your body. Again.
Yeah, there are certain networks in your brain responsible for the perception of pain. Responsible for the perception of pain. So if you know how to manipulate these networks, you can control your own perception of pain.
This is actually like your digestion works. If you know, everybody knows, if you eat the correct things, the digestion is going to be perfectly all right and you're going to feel better and really good. If you feed your brain with the right information and the right thoughts, you can it's exactly the same. You can control the perception of pain if you know how. If you understand the interplay.
I teach you how.
Yeah, and the other part of osteopathy, you can embed helpful exercises in your daily routine. You don't need pointless exercises, useless tools. I mean, this on first sight may be a useless tool, but the opposite it is. You just have to know. And there are no hidden costs, and of course, no voodoo or hocus pocus. I hope you can see that, and we make that point very clear. Okay.
So the last 2 years, I've lived pain-free.
Unbelievable.
No
Well,
painkillers, no painkillers anymore, never, and never went to a therapist again. So all I need to do is some training for my brain and a little bit of movements for my body, but I can integrate those movements in my daily life. So it's I don't need to go out. I don't need to go to a therapist. I don't need to have some tools or all these things people have at home.
And
for training and don't use it.
The best part of it is don't be afraid. Everybody can do this. You got two hands, I got two hands, I got the experience, and we're going to show you how that works.
Yeah.
Okay, so get to know the interplay with the 3 secrets. The secret number 1 is to become your own osteopath to ease pain. We're going to teach you how. Where do I have to pull? Where do I have to push? What tissue has to be loosened? Which tissue has to be strengthened or not? And strengthened, empowered? And why should you do that? And in which situation can you use those techniques to get that instant pain relief and for good? Secret number 2.
Mind over body to ease pain. Your mind is so powerful. It is so powerful that it can control your pain. So if you know how, you will be relieved. You will be pain-free, and you will always have an idea what to do and how to act or react.
Secret number 3, yes, food.
Not this one.
To ease pain. Well, that's the worst example you can get, but we teach you how and what has food to do with pain. So I'll just give you 2 quick examples so you understand what I'm talking about. It's not about losing weight. Of course, losing weight helps because your vertebra or all the other structures in your bones are not as stressed like before. But just imagine if you eat like really much, like almost everybody loves that. Your belly will put some pressure on. Yeah, it's just like, oh, that was a lot to eat and I'm so happy, but my back hurts. So the pressure, any pressure, always goes to where less pressure is. So of course that's the very soft part of your belly, so that's the front. But on your back, there are some special places in the anatomy where nerves and blood vessels have to go through, and that's a very soft spot too. So the pressure goes to that part too, and it will distract your back because you're eating. It's just physics, you know, the pressure is too much. So if you know what to eat, you can eat a lot, but if you know what to eat, the pressure will not be as bad, will ease your back pain. Another example is, and that's a little bit more complicated, but there is food that empowers inflammation in your body, in every cell in our body. And inflammation always hurts. For example, milk. It's known, science proves it. If you're drinking too much milk, like cow milk, inflammation in general in your body is going to be higher than it's supposed to be. And there's one magic trick, for example, just use the right spices in your food and you will get inflammation down again. This is secret number 3, is all about food. What can I eat for pressure to loosen or to weaken the pressure on your spine, on the nerves and the blood vessels? And what can I add to food to get inflammation down? For example, just for a moment, I mean, if you observe yourself, you know exactly what your body can like what your body likes.
Yes, yes, because some sort of food you know exactly you shouldn't eat because it's no good for you.
But it's so tasty.
Yes, but you know it's no good. You shouldn't eat it. And so try to eat things that you feel good about. And the second thing is add, for example, turmeric. Turmeric is...
Too many secrets, I believe.
Turmeric is a spice that is anti-inflammatory, whatever, you know what I mean.
It takes inflammation away, yeah. But you have to combine it with black pepper.
Yes.
Enough of secrets.
Yeah.
Okay, so as I promised to you, as we promised to you, here's technique number 2. This time I'm going to tell you the story first, and then I'm going to show you the technique. So I'm going to get out of there. Okay, so like that. Hi, there we go. So we need this for later. And I'll tell you a story about a woman visiting me in my praxis, and she had severe back pain. If I say severe back pain, she showed up in the praxis. I opened my door and asked her to come in, and she said, "Michael, I can't." And I was like, "Okay, why?" "Because my back hurts." So she was standing in the door like that, and like, "I cannot move." And I was, okay. I took her by the hand and gave her a lift to the treating table. And I said, "Okay, if you can't stand, lay down." And she was like, "Michael, I can't. I cannot do the transfer from the upright standing position to lay on my back. It is a nightmare." And then I thought, okay, how can I solve that problem? How can I get her like any relief, instant relief of her back pain that she can move? So that woman was from Vienna. Vienna is the capital of Austria. And I thought, okay, I have to catch her with something that's funny. So she has to laugh, because laughing, like pandiculation, eases your mind. You don't think about anything if you have to laugh. You don't have pain if you laugh. So I thought, okay, I'm going to make her dance. So I told her, "I'm going to make you dance." So she almost hysterically laughed and said, like, "What the heck am I doing here? I thought you're an osteopath." And I was like, okay, I show you what you have to do, and you just follow me, what I do, and then I promise to you, you're going to feel better. And this is what I do. I'm going to show you now. I want you to stand up. I'm going to show you my rear end now. And I hope you can hear the music.
And do it with Michael.
Yeah, come on. Okay, so what you do, you bend your knee, like alternatively. Like just bend your knees. And what that does is it drops your hip down, down. And now get a little bit of rhythm. And do it as in your speed. You don't have to be in rhythm or something. If you cannot stand it, or if you cannot do it like that, you can do it in that position. You know, it's like a rhythm. And then you try to stand up. From the back. And do it every morning at the bus station, at work, on the restroom, wherever. Stop it, please. And guess what? The lady from Vienna started laughing and said, "Michael, this is unbelievable. I'm feeling better." And now I'm going to tell you why that's the case. So why, like, bending your knees after each other can ease your back pain. So remember that bowl, your pelvis. That's from behind, like I dance right now. What I did is this. And what your lower back doesn't like, or the lower back doesn't like it, and then it goes up the pain, maybe in your case. What it doesn't like is extension and too much flexion. That would be too much of this or too much of that for a long time. What it loves and what it's made for is side motion. This one. Da-dum, 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 da-dum. That's very easy for the lower back, for the vertebra down there. And if you move your lower back without pain, your brain thinks like, "Oh, Well, maybe there's no problem at all because I can move all of a sudden my lower back and it doesn't hurt. And that's how you trick your brain. It's all about the brain. So this was technique number 2. And this is something you can use every day. And you've got technique number 1 with the wooden spoon. And you got the pediculation.
And Michael said it, you trick your brain. Your brain has, if you're in pain for a long time, because we're talking for being in pain for a long time and nothing helps, your brain has sort of got stuck, sort of, just think like that, like a computer that doesn't work anymore because it got stuck for some reason. And that is what's happening in your brain. Your brain gets the signal, there's something wrong in the back, there's something wrong in the back, there's something wrong in the back.
Even though there is nothing wrong anymore. Yeah.
But there's still this signal. And if you do this, if you dance and laugh and yawn, and by doing these small, tiny movements, you can do them in the morning, brushing your teeth, for example, or while cooking. I do that while cooking. Then you sort of give a different signal to your brain.
But from the same area. From the same area.
Now the signal is no pain. There is no pain. Everything is in order.
And you have to put that on loop.
Exactly. And the longer you do that, the easier this goes, and the easier it becomes, the earlier your pain stops sending these signals.
Yeah, and the pain realizes this is the number one, how do you call it?
Signal.
Yeah, the number 1 signal is no pain.
Yeah.
And it's not the number 1 signal painful if you move something down there or up there or in your head. Okay, so once more, if you want to know the interplay of your pain, your brain, and your body, don't hesitate. Start it today.